dream cure.
What's that?
A full day at school. You're fine.
Aw, phooey. Elroy!
Way back when, the Jetsons gave us a little preview of what telemedicine might look like in the future. With Elroy claiming he's afflicted with a mysterious malady known as Venus virus, Jane, the mom, is able to call on the services of a doctor who appears in a digital portal and unfortunately determines that Elroy's strange malady is caused by something a bit more common: too much junk food. Telemedicine, the marriage of digital technology and communications tools with doctors, nurses, and healthcare specialists at the patient's bedside, has already arrived at the Southwestern Vermont Medical Center in Bennington through its partnership with Dartmouth-Hitchcock, and more is on the way. At a presentation made Monday, August 7th at the Hunter Seminar Room at Burn Burton Academy, as part of a series of talks hosted by the Green Mountain Academy of Lifelong Learning, Dr. Trey Dobson and Dr. Kevin Curtis broke down what the new services have to offer both patients and medical staff. SVMC began offering the first of its telemedical services, teleneurology, back in April. The service is expected to increase the speed of care for patients experiencing neurological problems, such as stroke. Without its own neurologist available 24/7, the hospital staff can now access a board-certified neurologist when the need arises. Tele-emergency services were added in May. This service allows the doctors and nurses directly treating the patients to have the backup assistance on call at all times for second opinions and support services that might otherwise take away from their time directly treating the patients under their care in emergency situations, when time may be critical to a patient's health status. A third telemedical service for the ICU or intensive care unit is expected to launch this fall. Tele-ICU will provide continuous monitoring of patients in the ICU in support of the physicians and nurses on the scene at the SVMC's main hospital in Bennington. This will allow patients who might have had to have been transferred to other larger hospitals, which offer more services, to stay at the local hospital, closer to family and friends. In an earlier interview conducted in July, Dr. Dobson described each of the three services in detail.
Well, telemedicine, I could talk for an hour on this, has been around for a long time. Even my dad, who's a physician, would do telemedicine by calling up people on the telephone and getting, consultative advice, or the patients doing it. But this is really bringing in the ability to, using technology, to really see the patient and understand what's going on with them and make diagnosis recommendations and treatment recommendations. So we've embarked on three initial initiatives. The first was teleneurology. We currently do not have a neurologist on staff at SVMC, but even when we do, they're not available 24 hours a day for emergencies in the emergency department or in the inpatient setting. So this allows us to dial up a neurologist who's available 24/7, and then using a camera, the neurologist can interview the patient. They can talk to the physician, they can talk to the nurse, and come up together with a diagnosis and treatment plan for a patient presenting with an emergent or urgent neurologic condition to our hospital. So we can get that treatment going, and if the patient needs to stay here, we can continue the treatment. If they need to be transferred elsewhere, we've started treatment earlier. So that's the first one. The second service is teleemergency. Teleemergency is a setup where we have two of our resuscitation rooms in our emergency department. So we have 16 rooms, but two of them is where we do our take care of our patients that are really needing resuscitation from either a trauma, a heart attack, or some life-threatening event. And by using the teleemergency, we connect with Dartmouth-Hitchcock or Avera Health in South Dakota and have an emergency physician and an emergency nurse on the other end of the television, of the monitor. And so we work collaboratively to take care of our sickest patients. So some of the services that they do on the teleemergency that you wouldn't think of really add value. So one is right now, or I should say before we had the service, if I'm taking care of a very sick patient at the bedside, there's a nurse with me taking care of the patient. There might be a respiratory therapist taking care of the patient. And then you have another nurse off in the corner typing up the whole encounter. When we call out medications, he or she has to put those in the computer. And it's really just an additional resource that doesn't need to be set up that way. So now through the teleemergency services, that nurse can be at the bedside of this patient or with another patient who is waiting, so we can really give care in better time, while the teleemergency services are taking documentation, making the phone calls that need to occur that normally would take our time. So the main advantage is it keeps us at the bedside with the patient instead of staring into a computer screen or talking on the telephone. Removing the nurse from the computer and having he or she at another bedside improves the time to the fact that the next patient gets seen earlier, and then overall you can imagine that that makes a much more efficient system. So patients don't have to wait as long, we get patients transferred more quickly or get them upstairs to our ICU more quickly.
Right now, these services are only available at the SVMC's main hospital in Bennington, but some more limited telemedicine services are expected to be rolled out at the SVMC's satellite locations, beginning with the hospital's Northshire campus in Manchester, starting this fall. Other telemedicine services, covering fields like telepsychiatry, telepharmacy, and teleradiology, are already in use in other hospitals. Telemedicine might also be one way that eventually, perhaps as the costs of the services come down, hospitals in rural locations can access top-tier physician and nursing care for their patients. For the GNET TV News Project, I'm Andrew McKeever.